When you look at the number of deaths in the U.S., climbing and climbing, it is pretty horrific. What will it take for this to stop? Is a vaccine the only way to getting a true handle on this?
Well, good morning. I wouldn't say, absolutely a vaccine is certainly a great step in the right direction. It is not the only way. We saw with our first wave of this infection prior to the summer that, very strong measures, stay-at-home orders, the mask requirements, the ordinances of curfews and those types of things was effective as social measures and public health measures. So it's not the only way. And frankly, we won't have enough doses for it to be the only way. So it has to be a combination.
When will we see the first approval in the U.S.? And how quickly can we see an approval of 2 vaccines, 3 vaccines?
Yeah, certainly. Well, there's lots of speculation that the first approval will be sometime before the end of the year. The FDA has 2 meetings currently planned, one on the 10th of December for the Pfizer-BioNTech vaccine, and the second on the 17th of December for the Moderna vaccine. Those are open to the public. Anyone can go and live stream them, and they will be televised a variety of streaming channels. So you could find out exactly what's happening on those vaccines. We do believe once the data is in and is reviewed, however, it generally takes, obviously they're fast tracking, but typical process is not in play here. This would normally be months and months of review. Now they're looking at really trying to fast track these and review the data as fast as possible. So it is within, but it is potentially, I would say, plausible that one of them could be approved by the end of the year and possibly a second or early in 2021.
Jason, once these are approved, does the U.S. have a proper infrastructure in place to distribute and vaccinate quickly?
Well, given who the initial recommendations have been to vaccinate, those in long-term care facilities and frontline health workers, at least from the CDC's Tier 1 vaccine schedule, the answer to that is probably yes. My biggest concern with these vaccines is their cold chain requirements. So they have to be stored in refrigerators, freezers, and so even up to the point of giving the doses. So many pharmacies across the country are scaling up, trying to get these types of refrigeration capacities, freezing capacity, which they don't currently have. But at hospitals and potentially at some long-term care, not all facilities, they may have this capacity to store the vaccine up until the point that it's administered. So that will be a really key issue with these 2 first vaccines.
Jason, how contentious will it be who gets the vaccine first? Is there a clear plan on who should get access so that you reach herd immunity quicker?
Yeah, well, it would definitely be a passive form of immunity through vaccination, not herd immunity, obviously, because herd immunity implies people are being infected and a great number of people infected. But I would say that in terms of the vaccine prioritization, there's been a lot of reporting around this from various, the National Academy of Medicine and other groups. CDC just came out with new recommendations to say how they're going to tier the response after long-term care facilities and frontline workers. They would move into people with comorbidities who are over the age of 65, and then after that, people without comorbidities in that age group, and then eventually the general population.
Jason, thank you so much. Jason Farley there of Johns Hopkins.